All right, good morning, everybody. My name is Dr. Ryan Shakely. I'm from the Morrison Chiropractic and Wellness Center here in Salisbury, Maryland. And we're going to go through today and do a presentation about injury prevention, working safely, back safety. Okay, and we're going to cover a lot of topics today, talking about why it's important to prevent back injury, as well as how to do that. Okay, so let's go through. So first, we'll just start off talking pretty much about why you're here. All right, very simple. Your employer is concerned about your health and safety. They want you to be safe at work. Very simple. And basically, we're just going to go through. It's an educational opportunity here. It's an effort to reduce and eliminate those injuries that happen at the workplace, something that's very easily preventable. And it's very easy to do that just by learning safety precautions. Okay? Keeping employees healthy and productive, and it also saves on costs not only for the employee but also the employer. Okay, so some facts about workplace injury that we have here. Employers pay between $15 to $18 million in workers' compensation every year, and that number does grow every single year. And most of those injuries are what we call MSDs, or musculoskeletal disorders, things that are very preventable. Okay, and we're going to talk about what they are and how that is. Like it says, millions of dollars are spent on those, and that's by the U.S. Department of Labor. And that number was actually from 2000, so you can imagine that is outdated. So a musculoskeletal disorder is an injury affecting, obviously, the musculoskeletal system. It can involve anything, including the muscles, the nerves, the tendons, ligaments, joints, cartilage, blood vessels, spinal disc, the entire body. Okay, and you can see that on the slide there. Areas of the body affected, everything top to bottom and everything in between. Okay. Types of injuries, very simple. Sprained or torn muscles, sprained ligaments, inflammation of joints and tendons, pinched nerves, degeneration of spinal disc. All those things are included in these types of injuries that are very common. And you can see the different types of disorders and syndromes listed there. Carpal tunnel, de Quervain's epicondylitis, low back pain, tendinitis, rotator cuff syndrome, sciatica, many, many different things that can affect, again, top to bottom, everywhere in between, because anytime you're using your body, you're involving everything. The body works as an entire functioning unit there. And anytime it's not working properly and you continue to repetitively use that, you can develop these breakdown of these systems. Okay? So what are the risk activities involved with this? Mainly bad posture, reaching, twisting, squatting and bending like it says up there. Operation of equipment that is difficult or hard on the body. Repetitive motions, doing the same thing in the same position over and over again can cause a degeneration or breakdown of that body, especially if it's done in the improper manner. And something that requires a lot of physical force or puts a lot of physical force or strain onto the body obviously is going to greatly reduce the function of the body there and quickly wear it out. So how do you avoid these musculoskeletal disorders? It's very simple. First one is just recognizing the symptoms. Okay? And we're going to talk about what those symptoms are, but you have to realize that there is a problem there. And then once you recognize what the symptoms are, realize what's causing that, and think about what you're doing at the time when you're having those problems showing up, because obviously that's causing these issues to show up. And then learning to modify those activities or really correct those activities so that we don't have these problems and don't have these injuries repetitively showing up over and over again, leading to a decrease in health later in life. Okay, so very simple, recognizing symptoms. Symptoms are simply a signal that there's a problem in the body. The body is just sending out messages to let you know that there's a greater problem at hand. Okay, symptoms are loss of motion, loss of strength, numbness, tingling, burning, stiffness, cramping, pain. All of those things are symptoms. The body's sending out those warning signals, trying to tell you that something you're doing isn't correct and it's not functioning properly. And so when you have those, when you recognize those symptoms, obviously it's important, it's imperative to seek treatment as soon as you possibly can for that. Because the sooner we find out what the problem is, the sooner you work on correcting that, obviously the faster the recovery, and more importantly, the decreased chance of having some long-term effects, a lasting injury, sometimes a career-ending injury that can show up. Back injuries, like we said, are the most common type of musculoskeletal disorder. That's why I'm here talking to you about back safety. Job activities that put a stress on that back make it very vulnerable to injuries such as repetitive bending, twisting, lifting, and reaching. Doing things improperly is really the key there. So understanding how your back actually works and what those limitations are allows you to reduce your chance of having those strains and potential injuries on the job site while you're working. Whoa. Let's go through here. Yeah. Your body was designed with natural, excuse me, natural limits of motion. Okay, obviously that's an extreme example. Okay, knowing your limits and understanding what those limitations are allows you to help protect that back and to work safely in a safe environment. That's not only for you, but for your other people that you're working with and also the patients as well. Okay, very important. So let's talk about what makes up the back. Okay, so your back is made up obviously of the spine. These consist of those movable bones called vertebrae with the intervertebral discs in between. They act like shock absorbers. Think of them kind of like a rubber ball filled with jelly. Okay, they allow those vertebrae to bend and twist and move, absorbing some of that shock. And then you have the ligaments and muscles, of course, that support that spine. Think of them very simply like rubber bands around that spine, allowing you to twist and move, but also move back to that original position and to maintain that structure. So you can see when a vertebrae is misaligned, shifting out of position, obviously your risk of pain and injury greatly increases. Okay, and it's going to wear out at a much faster rate. Okay, so the spine here has three balance curves to it when you're looking at it from the side. When you're looking at it straight on, you want it to be straight up and down and balanced. But when you're looking at this from the side, you want to see a low back curve, a mid back curve, and a neck curve. Okay, and if you're looking at someone from the side, you should be able to pretty much draw a straight line from the ear, down through the shoulder, down through the hip, and down to the feet. Okay, obviously if you're shifting away from that, you're not in a balanced position. Those curves are becoming reduced or too far increased. And what that means is you're not balanced, and that's when the strain's going to occur. Your body weight cannot be transferred properly. That spine is meant to act as an entire functioning unit, kind of like a spring. Okay, if we're balanced this way and we're curved that way, as I move through the day, it should bend and flex like a spring. Okay, and if it doesn't, if it shifts out of that position, it acts more like a rod and it will jam together and quickly become overloaded. Okay, movement and motion, like it says, become much more difficult, and it places unnecessary strain on the structures of those spine, on those muscles, on those bones, on those ligaments, on all those soft tissues especially. Begins wearing them out at a much faster rate. Okay, so how does this affect your spine when this shifts out of position? Like it says up there, the old saying, as the twig is bent, so grows the tree. Okay, if we're constantly in this shifted position, the body's very good at compensating. Okay, but the fact of the matter is, it's holding you and it's locking you in that compensated position, and your body actually goes through physical changes to hold you in that position. But it's locking you in a weakened position that's going to lead and promote more and more injuries that can occur over a lifetime. So like it says, day after day of spinal stress provokes those serious postural misalignments that can lead to more serious injuries as we're going along. Okay? So those postural misalignments trigger that condition that I as a chiropractor treat called a vertebral subluxation. So we're going to talk about that for a moment. The shifting of those vertebrae, putting that increased stress and strain on those soft tissues that surround it. Now misalignment of that vertebrae, when those vertebrae shift, it does result in a nerve pressure irritation. Okay, 80% of the time, you know, a lot of times we focus on that pain, but it's important to realize that 80% of the time when one of those vertebrae shifts out of position and becomes locked in that position, we don't always have pain that goes along with that. Okay, because you have sensation pathways that travel through that nerve root. You also have the pathways that control the muscles. You also have the pathways that control the internal organs. So many different systems, organ systems in the body can be affected by that. That nervous system controls every cell, every tissue, every function of your entire body. Okay, and when that's becoming decreased, you're not going to be as healthy. Okay? Affects the proper communication of those nerve impulses to the tissues. Very simple. Think of what happens if you put pressure onto a garden hose. The water flowing through that hose becomes disrupted. It can become cut off. Same type of thing can happen in these situations. So we're going beyond just the spinal structure, just beyond the bones, beyond the actual muscles, into that nervous system, disrupting that communication and decreasing overall health there. So what causes one of these spinal misalignments or one of these vertebral subluxations to take place? And the answer is it extends beyond just working. Okay, working does play a big role in that. Working in those repetitive positions or those slips or falls or those accident injuries that take place at work, same things can happen outside of work. Okay, so the things that happen at work can affect us outside of work, but the things that happen outside of work also can affect us at work as well. Okay, it can add all together to decrease that spine. So it's important, what I'm getting at here, it's important not only to use these lifting basics and this back safety at work, but also in your spare time at home as well. You have to consistently use them. If you make it a force of habit, you'll have a much greater decreased chance of having these spinal injuries as a whole. Okay, so just some more things that can cause that. Intense emotional stress, and that's a big one. We always have stresses outside of work and at work as well. And the way I look at this is there's three basic stressors. Okay, there's physical stress, emotional stress, and chemical stress. The higher those levels of stress are on the body, the worse condition our body's going to be in. Okay, if you can focus at work on minimizing those physical and emotional stresses, if you work on minimizing them outside of work as well, you're going to be much healthier overall. Okay. So what happens when we have one of these spinal misalignments after we've had an injury that takes place? That motion is actually altered in the body. The body is compensating, muscles are tightening up, and that's when we see a change in the posture. You'll see some people walking around with a shoulder higher or a head tilted or not moving evenly as they're moving around. They have a spinal misalignment in there. That spine is, their body is actually trying to correct itself for that. When those vertebrae shift, what happens is we get some nerve damage on that because those vertebrae are rotated over, they're compressing, they can stretch that nerve tissue. It begins decreasing the function. We've all heard of people with a pinched nerve. This is exactly what we're talking about. There's direct pressure causing direct nerve damage there. If that nerve damage is around long enough, that damage can become permanent. That's why it's important, again, we talked about before, getting it taken care of as quickly as possible when there's an issue at hand. Third one is a muscular imbalance takes place. Those vertebrae are shifted out of position. It's putting pressure on those softer tissues of the body. So what happens? The muscles of the body begin tightening up. They spasm up. They're trying to protect that nervous tissue. They're protecting the more delicate tissue. They're trying to give compensation to that spine, but as a result of that, they're actually weakening the structure of the spine because it's locked it in that compromised position. And then what happens? Soft tissue damage. The structures of that spine actually begin wearing out and breaking down. Because those vertebrae can't move, because those muscles have locked it in that position, it transfers a lot of extra force onto those soft intervertebral discs. Okay? Again, think of them like a water balloon or that jelly-filled ball. If we're shifted to one side, if we're squeezing on one side, that pressure, that hydraulic pressure gets pushed to the other side, causing a bulging disc, which can lead to a herniation. Okay, which means there's going to be a breakdown of the structure at that level. If that herniation travels backwards onto those nerve roots, intense pain, okay, is going to be one primary factor there. But more important to that, it causes compression on that nerve root and can cause many, many issues through the body. And then after that, if it's been broken down for a long period of time, you start developing these bone and body changes. Okay? Because there's a lack of support, the body actually begins laying down degenerative bone spurs at those levels in an attempt to fuse that actual spine together in that position because it cannot return itself to that position. Again, that's why it's important to take care of these issues as soon as possible before it becomes a degenerative arthritic condition. Okay, so I keep mentioning these nerves. They did a study on those nerves, okay, and they found that, of course, when they cut that nerve, whatever nerve was at the end of that line died off, okay? The brain was still trying to send the information down the line, but it wasn't reaching that internal organ. But what they also found was they wanted to find out how much pressure it took to actually decrease that nerve sense that set down through there. And they found that only the weight of a quarter on top of that nerve, a small coin, decreased at 60%. Okay, that can cause pain, that can cause numbness, that can cause tingling, burning, decrease of control of the muscles, decrease in control of those internal organs as well. That's why it's so important to take care of your back. So like it says, if a nerve was cut, it died. If there was interference to that nerve, it died. It just died at a much slower rate, okay? So how do we prevent these things? Using good body mechanics, okay? Very, very simple things we can do on a daily basis to keep ourselves healthy, okay? Operating your body safely and effectively without those stresses, strains, injuries, and fatigues. So keys here, using your arms and legs for lifting, okay? Many of these things you've been told many, many times, but they still ring true. Okay, it's very simple things you can do. It's just a matter of incorporating them into your daily lives. So using your arms and legs because they have the larger joints and the muscles than the spine do. Using those to actually move things, not bending and trying to push things around with your back. Moving slowly and carefully, planning your move. Those muscles and ligaments, they actually need time to move. If we start moving too quickly, you're going to overextend and overexert yourself, quickly moving past what your muscles can actually sustain you with, and that's going to lead to injury as well. And when you're moving things around, hold those objects close to the body. Okay, when you're holding something close, you have much more control of it. The muscles have to do much less work. Every inch you hold that item away from you, the more pressure that's putting on your back to hold that item up. Okay, it's very, very simple. So also, when you're moving things around, try not to twist and turn. Okay, it's much better if you're holding something, especially if it's got some weight to it, to pivot your body and move your feet. Okay? Not only when you start twisting and turning does that put the spine in a much more compromised position, twisting on those intervertebral discs and causing wear and tear on them, but also if you're turning your feet, you're in a much more stable position as you're moving to avoid slipping or falling. Planning your move. This is very important. Think about what you're going to be moving before you pick it up, before you move it. Whether it's an item at the office, whether you're even dropping a pencil on the floor to bend over to pick it up, whether it's a patient in hospice care, any of those things, you need to plan your move out, and if you're having someone help you, communicate with them on what the plan of action is, okay? And that's really the #1 key, is communication on what you're doing if you're working with someone else. Using a good support base as well, very simple. Keeping your feet spread apart, keeping your knees bent, a more athletic stance if you're going to be moving and doing things throughout your day. It's something very simple. If you get used to being in that position, it'll help you out greatly. Okay, it relieves the pressure off of not only on the back, but also of the hips, of the knees, of the feet, all the way down. Bracing yourself. This is important as well. When you're going to be lifting or moving or doing activities through your day, just focus on tightening those abdominal, tightening those core muscles up. Tightening that up greatly reduces the stress on your spine at any given time. It's something very easy to do. A lot of us just start picking things up and twisting and turning and moving. If we focus on tightening that up, that'll help keep you in a more rigid position, and you'll naturally move through those more proper motions. It's very easy. Keeping your back straight when you're standing, when you're bending, when you're reaching. When you have to do those things, don't arch your back, don't twist your back, don't bend your back. Keep it in that, keep those knees bent, bend your back over in a more straight position. It keeps you in a more supportive role. Again, this relates to tightening up those core muscles and supporting your own back. And pacing yourself, okay? Preventing overexertion. When we start moving too quickly, when we're doing too much, it quickly overloads that spine. Okay? Too much pressure on that spine, the muscles become overworked, and they begin becoming weaker very quickly. Just like if you were to go to the gym and start lifting a lot of weights, your muscles do weaken over a period of time of heavy use. The same thing can happen when you're lifting and moving items or people or whatever. So just pacing yourself and avoiding putting yourself in those compromised situations is the key. Thinking about what you're doing before you do them. Okay? Looking where you're going to go before you start moving. Very, very simple things. So actions to avoid. Again, sudden, quick movements. Okay, you don't want to just start twisting and turning and moving. That's when things start shifting out of position. Okay, the muscles can't respond fast enough to keep up with you sometimes. So move at a slower pace. Bending at the waist. Okay, you don't want to just bend right over. Again, bend with the knees, not with the back. It's always going to be true. Okay, it's very simple. We've all heard that before. It's always going to be true. Okay, don't twist at the waist again. You want to move those feet. Okay. And don't do combining movements, okay? If bending is bad and twisting is bad, then bending and twisting at the same time is exponentially worse, okay? It puts that spine in a much more compromised position. So trying to eliminate those things, again, tightening the core and moving very carefully and thinking about what you're doing, okay? You can still work at a good pace, it's just thinking about what you're doing as you're going through and doing it. Okay, so things that you can do to help prevent these things before you even get to work. That's another key, okay? Because things you do before you get to work help you while you're at work, which means that you can do more when you get home from work, okay? When you're on your own time, you can do more because you're not tired, you're not fatigued, you're not injured. So stretching, very simple. Stretching and strengthening before your shift can help prevent straining the muscles or injuring the spine. We're going to talk about some very simple stretches and things that we can do to help out with that now towards the end of the presentation here. So. But here we go, back bend, increasing flexibility, just standing with your palms on your back and stretching back. Very simple, okay? Hold the position for 5 seconds, repeat a couple times. Okay, you can do that right before, you can do this before you go to work, you can even do this, and we're going to show you before you, let's say you forgot to do it before you get to work, but you're getting ready to pick something up heavy, spend a few seconds to stretch out and get moving and then do that, okay? It'll greatly reduce those stresses on the spine. Arm circles, holding the arms out, moving them around, loosening up the arms, loosening up the shoulders, loosening up the neck. Very simple. Move the arms in circles for 20 seconds, repeat a couple times like it says. Wall slide. This is great for strengthening, okay? Standing with your back against the wall and slowly sliding yourself down, holding it there for a few seconds, and also standing back up. Another one you can do here is a regular squat, holding onto a chair or an item, tilting your head back to hold your back straight, going down and standing back up, because you know through your course of your day, if you're going to be doing squatting, the more you practice these things, the better you're going to be. You won't have to think about them when you're doing them. Think about a professional athlete. How many times does that baseball player practice that swing? When he steps up to the plate, he's not thinking about the dynamics when he's performing his job. Okay, he's just performing it because he's done the basics so many times he knows how to do them. So it's about practicing those very, very basic movements and making them, incorporating them into just your daily life. You won't have to think about those things as you're going through. The more you do them, the easier it'll become and the easier it'll be to protect your back. Pelvic tilt. You can stand, sit, you can even lay down when you're doing this, just tilting your pelvis forwards and backwards. Okay, strengthens up the muscles around that pelvis. As you're moving around throughout your day, you'd be amazed how many times you move that pelvis back and forth, forwards and backwards, sitting and standing and doing all those things. Again, just practicing these movements, loosening up and strengthening them up greatly reduces the chances of having any injuries. Modifying your work activities. We're going to shift gears a little bit here. So, following basics, okay, lifting basics, lifting right. We're going to talk about lifting difficult loads, lifting in awkward places. We're going to talk about building a load, pushing and pulling, bending and reaching. And we're also going to talk about moving a patient around here for a little while as well. So, talking about lifting here. Has anyone here ever thrown out their back while doing something they thought was very simple? Getting a file, bending over to pick up a pencil, twisting to pick up a cup of coffee. It's just about moving in that wrong position at the wrong time. And typically what's happened there is you've done that wrong repetitive motion so many times without even thinking about it. Things have slowly shifted out of position. It was just enough that one time to cause the problem. Okay? But it's about learning from those things. Okay? Trying to identify them before they become an issue is important. But if something does happen, learning from that as well. Think about those times when those very little things have caused that problem. Again, practicing those very, very simple basics on a daily level makes it, you don't even have to think about it. It just becomes very simple for you. So lifting safely is crucial to your job and your health, okay? Your home life as well. So what is safe lifting? Again, a lot of these things are repeating themselves just because they are so simple. Keeping your back aligned while you're lifting, maintaining your balance and your center of gravity, letting your leg muscles do the lifting, and before lifting, assess the situation. Do you need help? Is it too heavy? Is it too awkward? Again, thinking about what you're doing before you do it. Okay, a lot of people just jump right into a situation without doing a full assessment. Okay, very, very simple things you can do. Okay? So, it's very, very simple. You can take lifting in stride if you know how to protect that back. Again, lifting with your back puts too much strain on those joints and muscles of the spine. Lifting right involves a few very, very simple things we can do, simple steps. And again, remember to rely on your legs and not your back. And it's very easy to adapt those safe lifting principles. Okay, so, lifting right, learning the steps. Okay, doing a deep squat, bending your knees, testing the weight, getting a grip on that load, and again, keeping that load in close to your body, hugging it, and then lifting, aligning your spine, making sure your spine is in that straight position, and then simply standing up, lifting with your legs. Very, very simple. That applies, again, not only to office, inpatient care, outpatient care, anywhere you're at through your daily lives. Okay, so bend with your knees, testing the weight, get a good grip on it, keep it closer to the body, aligning your spine and lifting with your legs. You can either do a squat down or you can kneel down on one knee if that's easier for you and then picking yourself back up. Again, don't lift with your back. Puts too much strain on the joints and muscles of the spine and the rest of the body as well. So lifting difficult loads, sizing up that load. Again, here we're incorporating some exercises before you're going to be doing that. If you forgot to do your stretches or your exercise in the morning, do some pelvic tilts, do a little bit of warm-up, warm yourself up. It's a physical activity. Okay? If you're going to go to the gym, if you're going to do some exercise, obviously you would warm up and stretch before you did that. The same thing happens through our daily lives. We do much more work, we burn much more calories through our daily activities than we do going to the gym. So it makes sense to loosen up and strengthen up before we begin our day. Lifting odd shapes, like it says, testing the load, getting the load as close to your center of gravity as you can, and following the basic steps. Okay? Lifting heavy weights, test the load. If it's too heavy, get some help. You know that if someone asked you to help them with something that was heavy, you would say, no, sure, no problem. So expect the same from them. Okay? Don't feel bad about asking for help. And again, here's a big one there. Use verbal signals. If you're lifting something with somebody or moving something or someone around, communicate what you're going to be doing beforehand, what the plan of action is, what's the best way to accomplish that goal. Okay? Work as a team. Okay? Lifting awkward loads from high places. Survey the space. If you're bringing something down from a higher area, look and see what the dynamics of that are going to be, where it's going to be, what it is, how much it weighs, where it's going to be going. Again, loosening up, like it says, do a back bend. You can do the back bend, loosen up, do a little bit before you get going here. Push to test the weight. Okay, grip the load securely, slide the load to the edge and down to your waist level. Again, keeping it as close to your center of gravity as possible, readjusting your load, and then slowly put the load down. Again, bending with the knees, not with the back, or kneeling down. Okay, lifting awkward loads from a low place. Just the opposite, doing the back bend, loosening up, surveying what's going on, kneeling down on one knee, support the load, reduce the stress, stand back up, lifting with your legs, keeping your spine straight. Very, very simple. Lifting awkward loads in a confined space. Sometimes we can't really move around in that space. Okay, if you can at all help sliding that and getting it to a better area to pick it up and move it, that's even better. Okay, like it says, kneeling on one knee, facing the load. If you have to, you can kneel on both. Just be careful not to twist your back. Crawl, don't stoop to move. Wearing knee pads makes it easier. Obviously, we don't have that option, but that does make it better. Sliding the load, like it says, whenever possible to lessen the weight on your back till you can get it to a better area. Okay, if something is in a difficult area, moving it to an easier area before we begin picking it up and moving it is ideal. All right? Moving right, so think it through. Holding lows close, balancing your back, pivot, don't twist, step, don't reach, bend your knees. Okay, those basics once again. Building a load, okay, this is when you're lifting several heavy objects, lifting the load, readjusting that grip, okay, using your legs, and setting that load down when you're done. Okay, very, very simple, just following those very basics as we're going through. Pushing and pulling, okay, it's always better to push something than it is to pull it if we can help it. Okay, I should say usually it's better to push something than to pull it, because our body, when we're pulling, we're having to tighten that back up and we're pulling against that, and that puts a lot of wrenching stress and strain on that back, whereas pushing, you're using your legs to push something away from you. Okay, but if you're pushing something, place your hands on the load, bend your elbows, bend your knees, that athletic stance, that stable stance. Bending your knees, putting one foot forward, pushing off with your back leg, short steps. Don't start pushing something very quickly, just work yourself into it. Pulling, when you have to pull something, get a firm grip on the load. Okay, that way you don't slip off of it. Bending your elbows slightly, bending your knees, putting one foot back for balance, push off with the forward leg. Again, working very slowly, working into that, looking to see where you're going, making sure there's nothing behind you, obviously. Bending, when you're working or reaching below your waist level, again, don't bend at the waist, bend with the knees, okay? Like it says, squat or kneel on one knee, keeping the back straight. Very simple to do. If you just tilt your head up just slightly, focus on a point on the wall. As you're bending down, it'll help keep your back much straighter. Bend with those legs, push the object with your legs, keeping the object close to the body. Very, very simple steps. Moving a patient, the basics, okay? Remember, like I said, it's usually better to push than to pull. Okay? Easier on the spine. Two people are usually better than one if it's available. If there's someone else available to help you, take advantage of that situation. Communication and teamwork are vital between lifting partners and the patient. So if you're moving someone around, you not only want to communicate with the person you're moving, but you want to talk to the person that you're going to be moving. Even if you're by yourself, moving that person around, communicate with them very clearly what the goal is here, because a lot of times they can help you out. They're not going to be fighting against you or moving in an improper manner that can cause you to suddenly have an issue with your back. Okay, so moving a patient in bed. Communicating with the patient. Again, two people are better than one if this is possible. Here it is. Don't lean over the bed any further than absolutely necessary. If there's something you need to get to on the other side of the bed, don't lean all the way over. Walk around to the other side of the bed. The less we're leaning, the better it is. If possible, use a draw sheet to roll or move the patient around. These are very popular. They have many different names. Some of them are very friction-free. Some of them, they just use a regular old blanket folded over in half. But using that to actually roll the patient up, putting a pillow behind the patient to hold them there, bringing them back down, sliding them and moving them with a draw sheet, I believe it reduces chances of injury almost in half compared to physically moving someone around. So very, very key. Obviously, if there's a Hoyt lift or one of those mechanical lifts available, that's even better. But a lot of times we don't have that option, okay, especially in a limited care facility or in-home care. And using pillows, like it says, to help hold that patient in position. When you're pushing, you get that patient in position, using pillows to help support them. Don't try to hold the patient and do things at the same time, okay? Minimizing the amount of things we're doing at one time, much easier to control the situation, okay? Moving a patient between a chair and between a bed. Very simple. Sit the patient up and gently swing their legs over the side of the bed, or if they're in a wheelchair, applying the brakes. Again, like it says, it can also be used if a patient's sitting in a chair. Ensure that that chair or bed you're transferring the patient to is within one turn of your body. If you're going to be moving someone, bring the chair over, bring the wheelchair over, bring them close to the bed as possible with you so you can get them up, so with one turn they're on that next thing. Don't try to pick them up and start moving them around. Get it as close, minimize the stress, bring it as close as possible together with still being able to move around. Approach the patient and place your knees on either side of their legs. So you want their legs to be between yours as you're standing there. Bending with the knees again, slide your arms under the patient's arms, locking your hands behind their back. Again, this is assuming that you're the only one there. Obviously, if you have two people under their arms, it's much easier, but if you're the only one there, sliding, again, hugging them close and lifting straight up. Same lifting basics, just applied to a person this time. Bending your knees, using your leg muscles to lift the patient, not your back to lift them up. And when your legs are straight, slowly turn that patient and ease them into the chair or onto the side of the bed. Very, very simple and basic. Again, taking it one step, one motion at a time. Okay, a patient that has fallen. Okay, so we've run into this occasionally. Once a patient has already begun to fall, it's best not to try to stop or catch them on the way down. That's when a lot of your injury to your back is going to take place. One person with potential injury is much better than you're having injury as well, and then they have to care for both of you. So guiding them to the ground, protecting the patient's head. Okay, assessing the injury, obviously, once a person has fallen, seeing if they can be lifted or moved up. If there's no chance of injury or their neck is fine, then you can begin to assess getting them back up. The best way to do that is to grab a chair. If the patient is capable of lifting themselves up, okay, if the patient is able to help communicate with them, do you think you can help get you up? They say yes, bring a chair over, that can help stabilize and help getting them up. Again, bending with the knees, keeping close, lifting them up, getting them into that chair. Hooking the arms. If the patient is stable enough to stand them up, much easier, okay? If they can't, then you need to bring over a blanket, get the patient over onto the blanket, two people lifting the blanket up onto a bed if they're not able to stand up. Okay, and getting them into keeping them stable and getting them into that position. Okay, very, very simple things. Again, pacing yourself and taking time to do it right. Okay, so posture. Okay, we all see people sitting with bad posture, moving around. Our posture on a daily basis in a work environment is important as well. Okay, if we're sitting in a compromised position, it's going to be causing problems, and this is usually the point of the presentation where I see people shifting and moving in their chairs. Okay, but we're going to talk about posture, and then I'm going to make a very easy summary on how to protect your posture right at the end there. So, good posture means your body is aligned and balanced. Improper posture cause a variety of those issues to show up. Okay, it's very simple. If you're constantly in a bad position, if you're, let's say, an office worker, you're sitting down, you're at home even after your shift, you're watching TV, you're in that bad position, you're training your spine to be in a compromised position. Again, the body is very good at compensating, but if we're putting it in that bad position, it's going to compensate to that. Okay? So we want to make sure that we're trying to focus on that as much as possible. There's a good picture up there. Good posture, back is aligned, she's sitting in the chair nice and square and even. Improper posture, sitting there leaning forward, hunching over. Okay? Benefits of good posture: deep breathing, healthy organ function, good circulation, more energy, reduced risk of injury, all those things. Okay, again, just focusing on that as much as we possibly can, just trying to stay in that. The more you practice this, the more you won't even have to think about it. You'll naturally stay in that good position. Proper posture, again, would be if you drew an imaginary line, like we mentioned before, from the ear down through the shoulder, down to the hip, and down through the feet. Okay, not having that forward head posture, not arching our back, being straight up and down. Okay, and if we just mentally, if we're standing there sometimes in the line at the grocery store, work on standing in that good position, practicing that. Okay, the more you practice that, the more greater chance you'll be in that good position. So, the thing with posture here, and I'll touch on that right now. One easy way to do this is, let's say we're sitting at a computer, we're sitting down, entering files in, entering in our records, doing what we're doing on a daily basis, and naturally we're on a computer. People have a tendency to get into that hunch position. The key is, if you're going to be sitting somewhere, or you're going to be in that compromised position for a length of time, let's say you notice you've been there for about 30 or 40 minutes, stand up and stretch and move around for 10, 20, 30 seconds. Very simple. It resets that spine. Focus on getting yourself back into that good position. Let's say you're in a work environment. You've been sitting there for a long time. Stand up, go get a drink of water, go to the water cooler. Nobody's going to give you a hard time about that. And just go to the bathroom, whatever it is. Get up and move around. Okay, that's the key. The body was made for movement. It wasn't made to be in these static positions that we like to put it in for so long. So getting up and moving around, help resetting that, and then you can go back to your work. Okay, very, very simple things you can do on a daily basis can make a great impact on your health. Okay, so some exercises for your back. Let's touch on those. Belly breathing, like it says, laying on your back, putting a pillow underneath your knees supports the low back. Holding the abdomen under your spine as you exhale, and then breathing in, breathing out. Okay, just deep breaths in and out, focusing on getting those lungs working and getting that chest expanding and contracting like it should, okay? That keeps our oxygen levels up. A lot of people don't realize they take very shallow breaths through their day. They're not staying well oxygenated, okay? The more oxygen you have in, the more it's going to be in your muscles, the more you're going to be able to do on a daily basis. Pelvic tilt, again, we touched on this before. Laying on your back, arms down by your sides, tilting that pelvis backwards and forwards, okay? It helps strengthen that pelvis up, but it also gets that low back moving. Knee to chest, okay? He's standing up doing this. You can also be laying on your back, bringing one knee up at a time, stretching that out, holding it there. When you stretch, you want to be holding that for somewhere between 6 to 8 seconds. You can bring both knees up at the same time if that feels more comfortable for you. A lot of people like to start off with just one, okay? And just kind of working that back and forth, stretching those muscles out. Again, it's knees to chest, both knees up. Bridging, okay, laying on your back, pelvic tilt position, hips rise, arching that back up, and letting it go back down. Very simple. You can also do this the other direction on all fours, arching the back, cat and camel, backwards and forwards, pushing and pulling, letting that back flex up and flex down, loosening it up, okay, very simple. Hamstring stretch. You can do this in a variety of ways. You can be laying down, you can even be seated, you can be standing, just propping your leg up and leaning forward, propping it up onto a chair, leaning forward, getting a good stretch on those hamstrings before you really get going through the day. Many people don't realize how great and how much less issue they would have on a daily basis if they just did some minor stretching, loosening things up and getting things moving again like they should. At first, yes, it's not comfortable. Over a period of time, just like anything else, practicing it makes it much, much better. You'll be able to move around much easier on a daily basis. Side stretch, laying on your side, lifting, going side to side. Very simple. You can do that standing. You can do that modified curl up. This is basically just like doing a sit up or a crunch. Okay, doing these again. What we're getting at here is very basic exercises that we do can make a big impact. Okay, going to the gym and lifting weights and running and doing all those things are great, but the basics are still the best. The push-ups, the sit-ups, the pull-ups, those things that are using your body weight. Okay, and the reason for that is not only are you increasing your strength, not only are you stretching out at the same time, but you're increasing what's called your proprioception. Okay, a lot of people, when we get to a certain age, the risk of falling becomes greater, okay, because we're not as good with our proprioception. Our balance has become reduced. The more you get used to exercising and using your own body and controlling your body weight, the better you're going to be for a longer period of time. Okay, and the key there is if you practice this enough and you become good at it, as you become increased in age, you're not going to be the one falling down and breaking their hip. Okay, it's very, 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 very key with that. Okay, and these simple exercises can be incorporated also with the patients that we're seeing as well. Okay, within their limitations. Okay, it's about working these things in. Here it is that I mentioned before, that cat flex, bending that back up, arching that back down, getting that mid to low back working together. Okay, the spine, even though we think of our neck or mid back or low back as individual when they're bothering us, they all work together. And if one's not working well, they're all not going to work properly. Again, it's all about those compensations and eliminating them. Sciatic nerve leg swing. This is very simple. Holding on, bringing that leg back, and just rotating that leg around and loosening that area up. Okay, it strengthens and loosens all at the same time. Very simple. Increases that mobility. Takes some of the pressure and stress off of those muscles that tighten up, that can compress on that sciatic nerve. Okay, so we're entering the home stretch. We're getting to the end here. Okay, very good. And this is key. When you're heading for home at the end of the day, at the end of your shift, your back will feel a lot better if you've used right lifting and moving techniques through your day. Okay, you can enjoy your free time more when you're less tired and your body is flexible and pain-free, and that's the key. Okay, obviously, as an employee, you want to be safe when you're at work. Okay, you want to be doing things properly, not only for you, not only for your fellow workers, but also for the people that you're in charge of taking care of. But when you get home, when you're on your own time, your family time, you want to be able to enjoy that. Okay, and if we're hurt at work, we're not going to be able to enjoy that. Okay, and if we accrue enough of these injuries over a lifetime, what that's going to mean is you're not going to have that quality of life later on. Okay, so protecting and doing the very simple things right now leads to much greater health overall. Okay? So it's important to take care of your back like it says, while you're at work and also while you're not at work. Following these simple steps outside of here as well. So think about what things do you like to do when you're out of here? Okay, when you're on your own free time, your hobbies, thinking about those things makes it much more easy to take care of yourself when you're doing the simple steps at work, doing the things you need to do while you're at work. So keep yourself healthy by taking time to relax, eating those balanced meals, and getting sufficient exercises too when you're outside of the work environment. Okay? So we're all finished up. That's in summary. If anyone has any questions, I'm here to answer them, okay? All right. Thank you very much.
Thank you. I do have a question.
Sure.
But I will applaud also.
Thank you.
Sure. I know years ago, and so the thinking may be different now, but years ago, back braces were used for healthcare providers. And
Sure.
I think, have we not entirely eliminated those now?
The
Have we?
and here's the thing as far as a back brace goes. Back braces are good, but people tend to use them too much. And what I mean by that is if you're as soon as you get to work, if you're constantly using a back brace, if you get up in the morning, you're strapping that back brace on, you've got it on all day long, and then when you're done with your shift, you take that back brace off. You've just spent 8-9 hours a day with your muscles not engaging. Okay, what that can do over a period of time is it can actually weaken the muscles that support that spine. So the key with a back brace is knowing when to use it properly. Okay, if you're going to be lifting something very heavy or moving something around very heavy, a back brace is a good idea. But as soon as we're done, you want to remove that back brace. If you're going to be doing something that you feel is going to be overloading that spine, a back brace is a good idea. But again, as soon as you're done, taking that off and allowing you to do your normal activity so it doesn't weaken the spine over a period of time. Because that was the big issue that happened with that, is people became reliant upon those braces and then they had no choice but to use them. So that's the problem that develops with that. Yep. Sure. Any other questions? All right, very good.
Thank
Thanks.
you.
Yep, thank you.
Wonderful.
Yep.
I love the stretching. I can feel it.